Hey everybody, welcome to In the Know with Nina. I'm your host, Dr. Nina Crowley. I'm the Director for Clinical Education and Partnerships at SICA, where we partner with healthcare providers to offer body composition solutions. And today I'm joined with one of my best friends and colleagues, Sara Hendrix, and she's a registered dietitian at the Medical University of South Carolina's Cystic Fibrosis program. And she and I worked at MUSC together for years and have never really crossed professional paths, though we hang out a lot on the side. So I'm really excited to bring her here to talk about how we do now cross paths a little bit because the cystic fibrosis patient population is starting to pay attention to body composition. So thanks for joining me, Sara.
Thanks so much for having me. And just to elaborate a little bit on that, I've been with the Cystic Fibrosis program there for about 10 years, and I see both the pediatric and adult centers. And I guess just to start out and give you guys a little bit of background on cystic fibrosis, or CF for short, what it is and how treatment has progressed in the past several years. CF is a genetic disease, and it primarily affects the respiratory and digestive systems. There's about 40,000 people in the U.S., adults and children, with CF. And historically, malnutrition and underweight have been the main nutrition issues in patients with CF. Nutrition status has long been defined by BMI in this population, and that's because of evidence that BMI and lung function are so closely linked, and then ultimately survival. And for this reason, most nutrition interventions have focused primarily on increasing BMI, so high-calorie, high-fat diet, oral supplements, and then sometimes tube feeding. If we fast forward to today, now overweight and obesity have emerged as an issue in CF. And this is due to advancements in treatment, especially in recent years with the introduction of new medications that we call highly effective modulator therapy. And these medications target the genetic defect in CF, and they restore function at the cellular level. So very close to a cure. Super exciting time to be involved with CF, but they've changed the nutritional landscape. And one of the unexpected outcomes of these therapies is that we're now finding that many patients gain weight much more easily than before. And there's a few reasons for this: lower metabolic rate, improved absorption of nutrients, and less gut inflammation. And this unexpected weight gain has brought on a lot of angst for our people. And understandably so. They've been told to eat a high-calorie diet all their lives to gain enough weight, and a lot of patients are now struggling with too much weight gain. And now there's this shift in focus to many of our patients trying to lose weight. And as you know, Nina, BMI doesn't account for differences in body composition, fat mass, and fat-free mass. And body composition has become a key factor in clinical outcomes in CF. So fat-free mass is positively correlated with lung health and overall outcomes, while there is an opposite relationship with fat mass. And so with increases in weight and BMI in our people with CF, understanding how weight is deposited in the body is becoming more and more important.
So when did these medications come about? Pretty recently, past couple of years?
Yeah, so there have been 4 medications. The first one came out in 2012. The most recent one that came out was 2019, and this has been the most effective and where we've seen the most weight gain.
I think this is it's so fascinating to me because I know this is a disease that it's a small amount of people that have it, I guess, respectively, but still it's pretty life altering. And I know, you and your team have, get really in depth with the care. It's a deep interdisciplinary team. I know, we have a mutual friend who does the behavioral counseling with these patients. And so it's really an all-encompassing team from birth, right? Where you're tracking their intake, you're talking to them about all of these, psychosocial factors. And it's really an all across the board lifestyle. And it's always been focused on gaining weight, keeping weight on, not absorbing. So from a psychological standpoint, I can just imagine how tough that's going to be. You're taking a medicine now you're absorbing more of the nutrition that you eat, which is great. But you've got a lifetime maybe of habits that are one way, and we're kind of shifting it up on you. So that must be pretty hard.
Yeah, exactly. And a lot of our patients, because it's a respiratory disease primarily, have very low activity levels, or did growing up. And so they're not accustomed to being physically active. So that's a whole new component, right, that we're trying to pull into our behavioral interventions with them.
Oh, right. And I imagine too, they're probably not strength training or lifting weights of any kind.
Many of them are not, right?
So you've got a whole new, is that somebody on the team? Is there an exercise focused professional on the
I
team?
wish we had one. No, that falls into my role a lot of the time. So there are CF centers all across the U.S., and a lot of centers do have a physical therapist on their team, which is great. But between myself and the respiratory therapist, we really try to, encourage physical activity.
Well, it's super exciting. I think it's also interesting to me because, as you know, I've been in the field of weight management and obesity for almost 18 years. And for a really long time, there was diet and exercise and lifestyle counseling. And then there was bariatric surgery. And so the gap of people in the middle really didn't have, if they weren't interested or a candidate for surgery and they weren't able to achieve long-term success with diet and exercise, they were in a gap. And now we have a large segment of our population who is candidate maybe for these medications that can really help change their relationship with food. And so it's been a really interesting time after a long period of not a lot of new. Every day we're hearing new advances in medication. So I think that's interesting parallels to this field as well. And I'd imagine, are you experiencing some patients who with greater levels of obesity who are taking some of the anti-obesity medication?
So this is very new for us. Because CF is chronic, they come to clinic every 3 months. And I see most of our patients about every 3 months. And we've really spent a lot of time working on these behavioral interventions to address the unwanted weight gain. And just within the past month, we've started partnering with our obesity and weight management center. And so we've referred a handful of patients who I know just one so far has actually started some weight loss medications.
Okay. Well, yeah, I mean, it's a very physiological component with also these behavioral, and genetic. You've kind of got all of it, right? And you've even got genetic counselors on board. I know that. So it's a very interesting interdisciplinary case. So I know, part of why we're talking is you're part of a team that's organizing an advanced nutrition course for dietitians and social workers. And that's a conference that we're actually going to be at, talking with the dietitians and social workers about body composition. So tell me a little bit about your conference and maybe.
Right. So this conference has been going on for years, and it's within the CF group. It's dietitians and social workers that come together once a year, and it's a smaller group. It's about 100 of each discipline, but they tend to be the more advanced, practitioners, and we come together and address tough issues. And so, within the past couple years, body composition has really grown with CF, and some centers are starting to incorporate, body composition analysis, but it's still very new. So I am super excited to have you guys at our conference to get more, we're going to do our body composition there and just get more hands-on with it. So this will be great for a lot of people.
And I know we've talked a bit about how you guys at MUSC might use this, but I'd be interested to hear too. I mean, again, you've got a patient population who does come back several times a year. They stay within your network. So you've got, say, a captive audience, right? But folks that you're going to be able to track long term. So how are you going to implement body composition testing?
Right. So, I think we'll make it part of our routine care. Honestly, it'll vary from patient to patient with their interests in assessing their body composition. But we at least hope to get baselines on everybody. And be able to use that as more evidence for the importance of weight-bearing exercise. And also as we make adjustments in their medications. So at this point, most of the patients who qualify for these new modulator medications are already on them, but we've had to adjust them for different reasons. We've been adjusting the doses because of unwanted weight gain. And so this will be interesting to look at body composition and see how adjusting the dose affects their body composition. Or for new patients who are just starting these medications, it'll be great to get a baseline and see how it affects their body composition too.
And I wonder too about even, you mentioned resting energy expenditure too, looking at that, how that changes if you see somebody before they start a medication and after. Do you expect that to change much?
That's a good question. It's all new to me, so we'll see. Yeah, I would think so, but we'll see.
And another thought, you mentioned a little bit about fat mass and fat-free mass. So, those two components or two compartments of the body, and measuring fat mass, fat-free mass, and then even getting more detailed into skeletal muscle mass, which you'll be able to do with our device. Do we think that patients who've been following sort of that more traditional CF diet, you said it's high calorie, high fat, we're expecting them to sort of start with higher body fat levels and lower, you said that's related to their functioning, lower fat-free mass.
Right.
And when they get on the medications, we'll kind of see, are they able to see some changes there?
Right. Yeah. We know that patients with CF have fat-free mass deficits. And so we're gonna definitely learn a lot through this process. But hopefully we can change that and patients will see the progression in improved fat-free mass.
Yeah. And I imagine this is going to be a good tool just to kind of give some sense to the unknown, right? Where you've only had the tool of weight, total weight and BMI. And once they're out of that child, adolescent, teen range and they're adults, it's not a lot of info to go on. So I'm excited. I think this is really going to be a interesting field. And I think really the patients, I imagine, will like having this kind of information too.
I think it's another tool that will be super useful for them. I'm sure so many are tired of hearing about their BMI and their weight. And so this will just give us another way to talk about health in general with them.
And I think for our behavioral counseling component and our friends there, I think that's also another piece, right? Do you see people, you kind of started to talk about seeing people who they would want to come off the modular medications because they're uncomfortable with the weight gain. I mean, that seems like a lot to unpack.
It is. And, we're actually doing a QI project at work right now, looking at the patients who we've modified their doses of these medications. And we're not seeing weight loss after adjusting their dose. And so it's not helpful from what we've seen so far to lower the medication dose as far as weight goes. And we know that when we lower the dose, there's then respiratory symptoms that, are suffering because of a lower dose. And so, I think this will help to show that as patients gain weight, they may be gaining more muscle weight, and that's good for them to see and understand.
That's a good point. So just trying to get a sense of the timeline, how long has it been taking them? Like they're starting on this medication at their, max dose or whatever. And then how soon after, or how rapid is that weight gain that you're seeing? Is it coming on pretty quickly?
It is. Yeah. I would say within 3 to 6 months, most patients have had pretty significant weight gain.
Okay. So yeah.
And the lung improvements, so their lung function improves within 2 weeks, which is amazing.
Wow.
So, and as soon as they stop that medication, they see a decline in that lung function too, for the most part.
Another thought that I don't know if you've thought about, I talk a lot about weight bias and stigma, and it sounds like, that's something that this group has probably never thought about or experienced in their pre-modular medication world.
Well, it's interesting you say that, because I think they saw a lot of stigma around being too low. There was a lot of pressure for them to gain weight. So for adults with CF, I mentioned that correlation between BMI and lung function. Well, we have a lot of evidence to show that females who maintain a BMI of 22 or more and males 23 or more have optimal lung function, better outcomes overall. And so there's been a lot of pressure, their whole lives to weigh a certain amount to meet those BMI goals.
So then even more staggering for that person who's been pressured to gain weight. Now they do, and now they don't feel comfortable maybe at that higher size, or that's related to some decline in function. And now so it doesn't get easier in all the realms, but they do see such I'd say, improvement in their longevity, right?
Right. And overall health, most patients say they feel so much better. They have energy. They can do so many more things that they couldn't do before. But they are they identify with being thin or underweight. And so it's been a huge challenge for a lot of patients to carry this extra weight around.
Wow. Well, Sara, this is a really great conversation. We can continue this outside of this venue if you like. But I hope that we can talk with a whole bunch of your colleagues in a couple weeks at the conference. And I'm really excited to see how you're able to use body comp in your practice. So thank you so much for joining me.
Yeah, thanks so much for having me. We're excited for these, new opportunities.
Awesome. Well, thanks so much. I'll talk to you soon.